It's 1947. You are a small child in a hospital ward in New York City. You are 3, maybe 4 years old. You don't know why you're here. A doctor has decided there is something wrong with your brain, and she has a treatment in mind. The treatment is electric shock. You are one of about 100 children she will treat this way. Her name was Dr. Lauretta Bender, and for years, this was called medicine. Lauretta Bender was not a fringe figure. She was a respected expert. She ran the children's psychiatric ward at Bellevue Hospital. She even invented a test doctors still respect today. Children copied simple shapes, and the drawings revealed how their brains worked. That work was real, and it was good. This is what makes the rest so hard. Bender believed in a diagnosis she called childhood schizophrenia. It swept up many children, including some we would now call autistic. She was sure it was a disease of the body, and a disease could be treated. It helps to understand the age she worked in. Doctors of that era had a deep faith in drastic physical cures. On adults, they induced comas, fevers, and convulsions on purpose. If it was accepted for adults, why not, she reasoned, for children? That single leap of logic is where the harm begins. So in the 1940s, she brought electric shock to the children's ward. On adults, this was already a common and frightening treatment. Bender used it on children as young as 3. She reported treating around 100 of them this way. The diagnosis was so broad it caught almost any struggling child. A quiet child, a withdrawn child, a child who simply didn't fit. Once labeled, a child could be enrolled in treatment for years. Bender measured success by how calm and cooperative a child became. But a subdued child is not the same as a healed one. In 1947, she published it as a success story. She wrote that the children were calmer, more manageable, improved. But calmer is not the same as cured. And nobody asked the children. Many of these children were wards of the state with no one to speak for them. Years later, Bender moved to a state hospital called Creedmore. And there, in the 1960s, she tried something new. A powerful new drug was being tested on adults everywhere, LSD. Bender decided to give it to children with her diagnosis. Some children were given LSD or similar drugs regularly, for weeks. It wasn't only LSD. She tried other experimental compounds too. Powerful drugs whose effects on a grown adult were barely understood, given to children who couldn't describe what they were feeling. Bender believed the drugs reached the illness at its biological root. She was not alone. Other institutions were running their own drug trials on the young. An entire corner of medicine had lost sight of who its patients were. Children far too young to understand what was happening to their minds. Again, Bender reported improvement. The children seemed brighter, she said. Today, giving a psychedelic to a small child reads as almost unthinkable. But at the time, she was a leading doctor publishing in respected journals. The system did not stop her. The system applauded her. This is the part that should